Hello, this is Dr. Cicala from Balanced Living Chiropractic. We are looking at a case study today of a patient of ours who initially had neck surgery about 5 years ago for neck pain that was going down into the left arm. The surgery resolved the issue for many years there. Like I said, he had it 5 years ago until he almost got in a car accident and stopped real hard, and his head basically whiplashed. And mainly the symptoms that he was experiencing from before came back. Now, this is a side view of the neck. We can see right here that is where the fusion is. This is between C3 and C4 that he was fused. The surgery before it was successful, and then once he started to whiplash, the issue started to come back. So we can work with people who are post-surgery, post-fusion, due to the specificity and the gentleness that we work on with the upper cervical technique. So just because you have a herniated disc, a bulging disc, a prolapsed disc, doesn't mean that chiropractic is not for you. It can be for you, and we could possibly save you from surgery. If we look at this patient's presentation in terms of their misalignment, and let me zoom out here so we can see them better. Try to get a better view. There we go. This is the person from looking at him from behind. So here's the left side, here's the right side. We can see the neck here. The head is up here, here is the eyes, and then the nose is right here. This line represents the middle of the neck. This one is the middle of the head. The one coming across here is going to be the top bone of the spine. These three lines should be perpendicular to each other, and the lines that are vertical should be along the vertical axis, which is this green dashed line you're seeing in the center of the film. This patient was shifted off to the right, and along with the fusion surgery, that is going to put a lot of pressure onto the nerves that are coming out of the neck. Down here you can see where the cursor is. That's where the pressure is coming off into the neck, and that could be causing this patient's issue. Within 4 adjustments, this patient responded very well, and the symptoms went away. This patient then discontinued care because he was no longer in pain. We would not recommend that, especially after a fusion surgery, but we will do what the patient wants us to do. So if you are a person who is a failed back surgery patient who has a fusion and now we're still having issues back into the neck or in the lower back, we are experts in the field at taking care of that type of an issue very gently and very specifically. This is Dr. Cicala from Balanced Living Chiropractic.